Hi. Hi, everyone. Welcome back to another episode of the Digital Health Digest series. Today, I'm really excited to invite my guest and introduce you to him. I'm sure he's a familiar face to all, and it's Jordi Ferrer. Hello, Jordi. How are you?
Hi, Alice. I'm fine. Thank you very much. And it's a pleasure being here with you.
Absolutely. Thanks for joining me. I know that we've been connected for a few years now and had the pleasure of meeting last year at Frontiers Health. But to give those who haven't had the pleasure of meeting you a bit of context, you have over 15 years of experience in key management positions in business development and strategy across Europe, USA, Middle East, and Africa. You're super passionate about value-based care and how technology can have the potential to increase access to care and also people's quality of life. You previously had completed a degree in economics and an MBA from IESE Business School. Currently, an investment director at Ship2B Ventures, an impact-led venture fund where you've already invested in some really exciting and innovative health tech companies like Mika, Psycho Medical, and Vivera Health Labs. But really excitingly as well, you're currently seeking to invest in some more impact-led startups. So really excited to get a bit more information on that and what you're looking for. Is there anything else that you want to add to that intro, Jordi, first of all?
No, that was pretty comprehensive. Yes, thank you very much. That's pretty much me. Also, I'm a parent of a dad of two kids. I would say as a personal note, but no, this was fantastic. Thank you.
Lovely. Brilliant. Well, I'm going to jump straight into it, and it kind of aligns with my last point there in the introduction. So, over the last year, it's been a pretty rocky road for some digital health companies. And we've had mixed messages from investors. We don't know where the investment's coming from. There's been a lot of bridge rounds. So from an impact investor point of view, what are you viewing within the digital health sector?
Yeah, so I guess that, this is a very good question, actually, and a very good first question. As impact investors, what we seek, what we look when we invest is that we are investing in solutions that can serve or improve quality of life of vulnerable populations, which are the ones that are at risk of falling out of society. And digital health is particularly interesting because it's a technology that allows to reach many people at a marginally zero cost, right? So of course it has a certain cost of development and cost of deployment, but scaling it up should be pretty lean and pretty straightforward. So we are quite interested in this technology in particular because of its potential to massively get adopted.
Amazing. Yeah. Well, I think we'll come on to that a bit later because I'm really excited to pick your brains on that particular point. I guess in terms of what you're currently considering as an investor, are there any specific metrics or outcomes that you prioritize when evaluating the companies that you look to invest in?
Yeah, well, maybe not specifically or not standardized across different companies or projects, but yes, we do look, of course, a lot of two angles, I would say, right? One of them would be the depth of the impact or of the improvement towards the patient or the targeted person. The other one would be in terms of accessibility, and we split accessibility into two fields. One of them would be more related to affordability, the cost of the solution compared to the gold standard or the current standard, the most
Yeah.
the broadly available standard. And the other one is in terms of reach, whether this new solution, this digital solution, is able to reach people whom are not being attended yet or who are not able to gain access to that. So we split these into two, and depending on the project, we will have at least one into the depth or of the quality of life improvement, and another one in terms of either reach or affordability, which is the accessibility field.
Right. Okay. Interesting. And what you mentioned cost there. So what successful strategies have you seen that digital health companies have applied to be able to scale their solution at that marginal cost?
That's a very good question, and I would say we are still learning, and the whole sector is still learning about it, right? Not that many companies have been successful. I would say there are three types of digital health companies, and they are pursuing different goals, and therefore they have different types of monetization. The first one would be a digital diagnostics, as you mentioned Mika and Vivira Labs at our portfolio. So this could be two cases. The other case could be more of a diagnostics or enhanced precision, or kind of a tool to practitioners, which would be the case of Saikai Medical, for instance. And then we have a um, third bucket, which would be quite a large one actually, which would involve a lot of productivity related solutions, either towards practitioners or towards healthcare institutions, or even pharma CROs, this type of solutions. We are particularly focused on the first two, so the ones that are somehow involving patients directly. And the models are pretty different. I would say the winners are those who are able to prove a material or a clinical positive outcome to the patient. Those are the ones that either one way or the other are able to capitalize value and monetize, right? So Vivira, for instance, they are added, or they are inscribed into a system in Germany called DIGA, which is basically a reimbursement system for digital solutions. There are certain requirements that you have to fill, but once you are in and you prove the value, you are able to negotiate a fee with the government that will sustain the business. There are other cases or other solutions in other countries, such as UK, Belgium, France is just starting to, in which you would have similar solutions with the government. I would say these are the ones that are starting to be successful, but yet to be, I mean, we still need to see a real winner and a real good one. US would be a similar case with CPT codes. Some of them are able to somehow get into those and monetize, but it's also a difficult, I mean, it's not a clear path, I would say.
Yeah.
And not an easy path, definitely. The other type of companies, the ones that are more related to productivity or to diagnostic or enhancing precision, they have two routes. Either the productivity one, so I'm able to process more images faster, or they can also go towards the precision or better outcome route, right? So they would be, not only I'm able to process more images per hour, but also I'm able to diagnose more or more precisely, and this has also an impact to the patient. I would say the latter is the one that is able to capture more value, but also the path is not so clear here. So it's also very different. So we're pursuing two different routes. The first one would be more of a volume play and competing with others, and the second one would be more of a self-made negotiation with different institutions, but if the value is there and is proven, then the monetization is considerably higher as well.
Okay. No, thank you for sharing that. That's really interesting, and interesting also that you mentioned that everyone's still trying to feel it out and find the best way to monetize, and nothing, no one's been really successful in doing so as of yet. So that's interesting to know.
I just, while you were speaking, I realized I probably forgot a pretty large group, which are the ones that are data gatherers, or the ones that are based on a lot of data. These, of course, there's a lot of value in here, but I would say the business model is often unclear here. So also we are still in an early phase, and it's not yet easy to see how this can be monetized. Okay.
That's good to know as well. When it comes to stepping away from monetization and looking more about scalability, how have you seen what are the typical ways, or have you seen any successful strategies that have been put in place to enhance accessibility, particularly when it comes to, non-European countries or not the US, like more rural areas?
Well, actually, rural areas is one of our focus. We do have a portfolio company that is basically providing primary care in rural areas in Germany as well. It's called Lilian Care. It's a hybrid model, so they do have a strong digital component in terms of virtual care, but they do have a physical practice because, again, because of the type of population and the scope and range of services provided, it does require also a physical brick and mortar setting. So back to your question, to me, this is part of the value proposition, right? If because there's a lot of value to capture there. If you're able to improve quality of life of people that are having difficulty accessing care, and by definition they are not following the right medical attention, they will very quickly get interest either from the government, social security, or from insurances, or I mean from whoever, right? So it's clear that this is one of the differentiating factors for digital health for sure, and from therapeutics to monitoring anything.
Yeah.
That.
Okay. And you did mention there as well about value capture. Are you seeing any trends at the moment within the digital health ecosystem about who captures the value? And yeah, tell me a little bit about the trends that you're seeing when it comes to that.
Probably, that's a difficult question. I would say, don't see. Yeah, unfortunately, I don't see a particular trend. I do see these three or even almost four categories that I mentioned
Yeah.
earlier. Some companies, especially the ones that are more related to R&D efficiency, if they are able to prove a lot of efficiency, they are quickly monetizing and quickly capturing a lot of value. The more you get towards the patient, it gets blurrier. I once used a comparison with the .com companies and Google and all these portals in the early times of the internet, when all these companies were just starting, trying a lot of things and burning a lot of money, and the business model was not there yet. While 20 years later, if we're looking at now, all of these companies are the most valuable companies on earth, and earning and monetizing incredible amounts of money. Probably, I mean, I don't want to. I'm not sure whether it's going to be the same scale, but we are I feel we're kind of in the same time spectrum, right? So we are at that moment in which technology clearly provides value. The system is not there yet because it's a heritage of a different system, like an in-person system, and it's not clear who is going to capture the value. We are starting to see these big tech companies jumping in, and they could and they are capturing part of it. Will they increase their stake into the healthcare sector? I don't know. I would say probably, but I don't know. And we are also seeing some companies that apparently should have a lot to say because they have a lot of health data, such as insurance companies. But they don't seem to be entering into this new digital space either, right? So, but they could eventually at some point. So I would say this is a big question mark, and we're monitoring it closely, and it will be very interesting to see how this deploys. But unfortunately, I'm not confident enough to disclose a trend or to foresee the future because it's really uncertain right now.
Yeah, no, that's an interesting point that you mentioned on the insurance players who haven't yet sort of dipped their toe in the water when it comes to digital health, because you would expect them to do so as they have so much data. Similarly to how you, I guess, see pharma now with the likes of Novo Nordisk and AstraZeneca, they've got their own digital health hubs and they want a slice of the pie.
But they don't seem to enter that much into play, right? I mean,
no,
they
yeah.
They might in the future, but to me it looks like it comes and goes as waves, right? There was a point before 2020 they all had their digital departments, then they kind of
Scale down.
Yeah, and some of them are now rebuilding them. So we will see. We will see.
We will see. We will see. Yes, indeed. And I guess one thing that's really important, as you were talking about there, is that obviously there's lots of different ways for digital health solutions to go to market, whether that's working with directly with hospitals, directly with patients themselves, or going through insurance companies. What would you say is the have you seen the most success with your portfolio? Where have you seen the most success? And more importantly, I think as well is asking about how do you offer affordable services while still sustaining profitability?
Hmm.
Loaded
Difficult.
question.
So these are two different questions. The second one is a bit more difficult. I would say in terms of value capture, or the ones that are able to monetize them more, because we are still in the mindset. So because the healthcare system has not evolved as much as technology, and we are still very dependent in the clinical validation and reimbursement, and kind of the players are still the same as they were 20, 30, 40 years ago. I would say that the digital companies that are behaving closer to the existing pharma companies, or to the existing status quo, are the ones that are able to monetize better. So, for instance, in Viviria Health, I think they are doing extremely well commercially, in part because their sales structure is very similar to a pharma one. Right? The way they are targeting doctors, the way they are, it's quite similar. Of course, it has to adapt, and it has its tweaks, but it's quite similar to that. And of course, they are taking advantage of a reimbursement system that basically tries to replicate
Yeah.
the typical pharma one towards a different type of technology, right? So it's kind of heavily focused on that. And then the other, and then the ones that are supporting R&D in pharmas are kind of very into the core of the drug development cost efficiency, and then they are able to capture a lot of value. So the closer you get to what affects either the final patient or the cost structure of the treatment, and the more clinically or the more evidence you have of the value that you provide, the better. The ones that are struggling the most are probably the ones that have little differentiation, or that are trying to go through a B2C route, or through new, let's say, typically tech routes, but that might not work that well into healthcare spaces.
Yeah. Okay. Well, yeah, and then just going back to that question around profitability.
And
Yeah, go on.
yeah, so how mm, I would say it's the type of business, right? And I mean, it's a technology that by definition can benefit of a business model that is profitable, because it's already providing efficiencies. And I would say it's by definition, right? It's uh, only by providing a better outcome through lower costs. Only those that are able to provide a better outcome through lower costs are the ones that are going to make it. So it's
Yeah.
a natural filter, I would say.
Okay. Well, thank you for sharing all of that, Jordi. It's super useful, and it's a topic that I don't get to talk about much, to be honest. So it's been really exciting to kind of delve into that. I always like to end with two things. Well, one thing, but I'm going to ask you another question. I know, appreciate we're already in Q4 now of 2024, but what would you predict for the rest of this year and 2025 for the digital health space?
So I'm really looking forward to the digital health space picking up. We've seen quite an improvement, I would say, lately in terms of investment, especially, and in terms even of regulation in different countries and in different initiatives. So I think the momentum is back. For sure, the technology will stay. As we were saying earlier, it's about how and who is going to crack the system. But we are definitely closer than ever, and every day we are closer to that. So I think it's going to be again, and it's already starting to be a hot field, and it's going to continue this trend, and definitely 2025 with a likely a more positive landscape. It's definitely going to pick up more. So I'm really looking forward for a really good momentum for digital health companies. I'm really
Oh, amazing. No, that's really good to
quite
hear. And
believer of
I've,
it.
yeah,
Yeah.
great. Well, I have heard whispers from the industry that 2025 is apparently the year for digital health companies. So fingers crossed. And then finally, just want to end on, obviously I mentioned at the beginning that you're looking for new investments. Is there anything that you want to share on that? Obviously to my network.
Well, no, yeah, thanks for the question. So, I mean, we are Ship2B Ventures, an impact venture capital fund based in Barcelona, looking for healthcare and climate investments in the healthcare part. Any founder that has a good idea that is solving problems either for elderly people or for people living with a chronic condition, we will be more than happy to evaluate the project and to get to know each other. So. Just this.
Amazing. Yeah, no, brilliant. Well, yeah, as Jordi mentioned, feel free to reach out to him directly, or I can put you in touch if you'd be interested in having a conversation. But thank you so much for your time. Been great to pick your brains on these topics, and look forward to speaking to you soon. Thank you again.
Thank you, Alice. It's been a pleasure, and also looking forward to speaking to you soon and to seeing you soon in person.
Yes, absolutely. Thanks, Jordi.